A new study was just published looking at the effects of intermittent fasting for patients with POTS. Here's the paper if you want to follow along. It's published in Scientific Reports. It's called Time Restricted Eating Improves Quality of Life, Heart Rate, and Mitochondrial Function in Patients with Postural Orthostatic Tachycardia Syndrome, an open label pilot study. We know that POTS is an autonomic nervous system disorder. We also know that these disorders can be heavily influenced by things that affect the immune system and things that affect our circadian rhythm, because both these things have a lot of effects on our mitochondrial function. So the authors wanted to influence the circadian rhythm of patients with POTS. And one of the ways that you can influence the circadian rhythm is not just from sleep timing, but you could also influence it through light. But in this case, they talked about meal timing. Time restricted eating is the scientific terminology used to describe intermittent fasting. For the purposes of this study, they used a model that's similar to what many practice, which is 16 hours fasted with an 8-hour feeding window. So they took these patients with POTS and they got them off any POTS medications before the study. After being off medication for about 2 weeks, they measured their baseline scores on their 10-minute lean test to measure their change in heart rate. They also measured different aspects of quality of life, and they also measured their mitochondrial function. The patients were given instructions for intermittent fasting. They did this intervention for 12 weeks. During that time period, they were given an app so they could actually track their food intake and make sure the patients were being compliant. After 12 weeks, they brought them back in for testing. They saw that there was a statistically significant improvement in their standing heart rate. There was also a statistically significant improvement in the change in their heart rate going from supine to standing. There were also large and noticeable improvements in their physical and mental health scores on the SF-36. There were also improvements on average on some of their POTS symptoms. But some of the most interesting data actually came from their mitochondrial function test. After intermittent fasting, the patient's mitochondria was better able to produce ATP during a challenge test. Now, it's important to remember that this is a hypothesis generating study. This wasn't a clinical trial. The sample size was small and there was no comparison to any other interventions. There could be a lot of placebo effects that are involved here. The study also didn't control for calories, so there's a good chance that patients may have improved just from caloric restriction. But we do know that intermittent fasting is generally safe and well tolerated for most people. However, if you do know that you have something called reactive hypoglycemia, then intermittent fasting probably is not going to be an intervention that you want to try. But if you don't have that condition, then some of these dietary changes and some of these circadian rhythm types of interventions might be a safe and gentle way where you can improve quality of life when you're having a condition like POTS.